Louise Scovell, first year practice-based PhD, LCC, University of the Arts, London. I'm going to examine several student participant-centered learning practices through my PhD. Achieving social change through visual communication. In describing how I intend to apply theories underlying teaching practice, I'll evaluate some central theoretical principles and elements of curriculum and workshop design. My PhD explores how design for social change can be more systemic, effective, and nuanced by engaging in complex situations at a local community level. My research seeks to rebalance gender equality at a core level within the female body. Through case study research into female reproductive healthcare awareness, it has the possibility to impact the wider health, status, and representation of women in culture and society. Research will be practice-based, exploring participatory action research and co-designed arts practice through a series of workshops. These will examine design for social change, building on visual archetypes, embodied cognition, and tacit knowledge in a localized community in Ghana. Typically, UN Communication for Development focuses on dialogue, radio stations, community meetings, school programs, etc. There is a gap in commentary about visual communication beyond UN branding. This is reflected in their UN General Assembly Resolution 50/130. My research intends to fill this gap by creating a prototype design for social change model for use in reproductive healthcare advocacy. The following paragraph sets out my aims and objectives and some of the theoretical frameworks I'll build upon. To examine how visual communication can be better utilized by NGOs as a tool for behavior change. To create situations where the community, a community of practice, generates their own visual communication methods for social change. Here, the community of practice, introduced by Wenger, functions on two symbiotic levels. That of UN-affiliated reproductive healthcare professionals and local women and girls in a localized community in Ghana. They both share the domain of interest, reproductive healthcare, the community, and shared arts practice, which will be developing their own design for social change. In this instance, situated learning will occur, as workshops will take place at reproductive healthcare clinics. Situated learning has two principles. Knowledge needs to be presented in an authentic context. Learning requires social interaction and collaboration. Here, Wenger's community of practice and Lev and Wenger's situated learning tie in really nicely with the Vygotsky social development theory. Vygotsky maintained that social interaction precedes development, consciousness and cognition are the end product of socialization and social behaviors. A workshop setup facilitates this type of social interaction. It also harnesses the effect of peer teaching, peer-to-peer learning, and scaffolding. Wood, Bremer, and Ross's idea of scaffolding parallels the work of Vygotsky. They describe scaffolding as a support given to a younger learner by a older, more experienced adult. Scaffolding will also occur if workshop participants are of different ages within the demographic of women and girls of reproductive age. These types of learning strategies are important since literacy is a significant barrier in developing communication for development. Globally, 64% of illiterate adults are female. A strong visual presence to communication materials will be pivotal. A primary objective of the workshop is to access tacit knowledge, specific to female reproductive healthcare issues, fertility, sexual reproduction, birth, maternal and infant care. In the tacit dimension, Polliner asserts that we can know more than we can tell. Not only is there knowledge that cannot be adequately articulated by verbal means, but that all knowledge is rooted in tacit knowledge, in the strongest sense of the term tacit. Through participatory action research approach, communities of inquiry and action evolve and address questions and issues that are significant for those who participate as co-researchers. Here, co-design focuses on process. Recognizing the aptness of design increases if stakeholders' interests are integral. Co-design is a development of systems thinking, which according to Churchman begins when you first view the world through the eyes of the other. Through sensitivity, reflection and understanding exists the possibility to become, think, learn and evolve as the other, the group. Phase 2, my pilot project. Primary research creating new knowledge in the field of design for social change. Case study research that is exploratory, working with UN-affiliated medical and field experts and gatekeepers from the local community. My research will be responsive by collecting in situ anthropological and ethnographic data, understanding country-specific issues, local cultural norms, beliefs and behaviours, seeking contextual, long-term and adaptive strategies for behaviour change, initiating a co-design process with reproductive healthcare professionals that is inclusive, collaborative and participatory to evolve prototype tools. Later in Phase 2B, these will be tested in visually created workshops with participants. Phase 2B is constructive, structuring an interdisciplinary common ground. I have adapted Denzin's triangulation theory into a spatial theoretical framework and central motif. At each apex will be a diverse stakeholder. They convene in the centre space an experimental lab for testing new design for social change theory and co-design practice. This will be a safe and confidential zone of interaction, creativity and neutrality. Participatory action research will be used to situate, assess, plan and reflect. Participants collect data documenting their personal narratives, i.e. body mapping, basic fine arts practice, audio, film and photodocumentary. Then we will reframe stories. Through archaeology of Ghanaian iconography, we will identify a visual language that is primal and archetypal by isolating persistently recurring geometric forms. We will recontextualize, reactivate and or repurpose these additional forms and test them as archetypal carriers of meaning, co-design visual communication materials. Using drawing, printmaking, painting, we'll create simple icon, index and symbol forms for street posters, flyers, discrete stencil motifs, markings and or large image and graffiti markup projection. I will test the archetype as interlocutor of tacit narratives, drawing on dialogic practice. Rogoff explains, art is my interlocutor rather than my object of study. It is the entity that chases me around and forces me to think things differently, at a different register or through the permissions provided by another angle. I will test whether the primacy of an archetypal visual language can be catalyst and visual marker for behaviour change. Co-created visual markers, reminders, could remain within the community, raising awareness about reproductive healthcare, i.e. female, antenatal, maternal, infant healthcare, family planning, in addition to measures for the prevention and treatment of STDs, fistula, FMG, HIV/AIDS. To summarise, from my research, I intend to generate a methodology which restructures design for social change, theory and practice for students, professionals, humanitarian organisations and aid agencies for use in visual advocacy. Through Dewey's reflective practice, I will examine opportunities for transferability to other areas of social need. Effectiveness, replicability and sustainability will be key issues. I will identify problem areas and approaches needing improvement in UN workshop implementation.